So the blood chemistry panel, we reran it. Everything was normal. There was just an issue. We overfilled the tube that we ran, so we reran the entire panel. Doc says everything looks great, so we're good to go there.
Okay.
As far as us being a little bit drooly, we think that it may be because he drank all the water. He may have just overloaded his system with fluids.
Oh, he slapped it.
Yeah, so just continue to monitor that. Maybe at home offer about a half a cup to a cup of water at a time. Just until we kind of get that surgery taken care of, and so that he's not
Don't let him drink too much water.
Yeah, don't let him drink too much. So half a cup to a cup at a time.
How often?
I would do that. I mean, you want him to drink. I rule of thumb say about 8 glasses a day, like for us. So, I would. I mean, maybe offer it like every hour, every couple of hours.
Every hour, a half a cup.
Yeah.
Okay.
I think that'd be good. And just make sure he keeps that down. The Serenia that we gave him today, that's the anti-nausea medication.
Okay. He's never puked.
Yeah, all that does is keep them from vomiting. That doesn't actually prevent the feeling of nausea. But that should work for 24 hours just to kind of alleviate, that if he has been feeling that way. We're very happy he hasn't thrown up, but that should.
So the hiding in the, I know you don't know him,
Yeah.
I've had him since he was a baby.
Yeah.
The face that he's making right now is the pain face.
Yeah.
So usually
we are getting some pain medications together for you guys to go home. We're gonna send you with some gabapentin.
Yeah, that's what she said.
Yeah.
I'm scared to death of that stuff. I've heard so many bad.
Thankfully, it is one of the safer medications for cats and dogs. I actually have a cat that's on it every day for arthritis, 2 to 3 times a day. It's very, very safe. You may see very mild sedation, but with the dose that we're giving him, I wouldn't expect it.
Okay, I gave him a tramadol
Mm-hmm.
yesterday,
Okay.
but I stopped.
Yeah, that should be that should be out of his system as well, so that shouldn't interfere with the gabapentin. I'll make sure to let Doc know that as well.
I told everybody
Okay,
just
perfect.
in case it.
Perfect, yeah. So we're gonna she's working on typing up some discharge instructions. It's gonna have everything written down for you. And then
He's doing that thing again.
Honey.
Do you remember I told somebody where he stares off into space and then starts drooling,
Yeah.
and he's doing that.
I got you.
He's doing it right now, and I've actually never caught that on video.
I got you. I'll let Doc know for sure, and I'll let her know that we got it on video. She wants to see it.
He's not normal. Usually,
Yeah.
he is bouncy, and
Mhm.
even at his age, right, so he's falling asleep.
Yeah. You had a big day, buddy. You're a sweet man.
And he's just the sweetest, and it's
Yeah.
just, oh man. So he's definitely gonna have to have surgery.
Yeah.
Do you know how quick?
So it really depends. I know Doc had mentioned when she came back, they were also asking about maybe doing the teeth at the same time. Is that right?
Yeah.
Yeah, that's definitely, if we can get it all done in one route. I mean, as long as, the doctor that's doing the procedure is okay with how the blood work is looking, and things will be okay. Again, so with teeth, and I worked general practice for a very, very long time. It's really hard to tell until we're in there, until we have them fully anesthetized, we're able to get a good full look in their mouth.
Mm-hmm.
And even then you can't always see everything without dental x-ray. So that's probably gonna be the biggest fluctuation time-wise. I would definitely speak with whichever doctor will be performing the procedure to see how long they estimate it, but I'd say we'd probably be under for at least a few hours.
That's not normal.
Hey.
Hey, baby.
Hi.
So the only thing that would make him wiggle his tail is, do you maybe possibly think that we could get a treat?
Do you want a treat?
Do you want a treat?
Do you want a treat?
See, he's not wiggling his tail.
Do you want a treat?
You want a tweet?
Oh
Want
my
a treat?
goodness.
And then there's one other word. Hey. What is that? Oh my god. What is that? Get it. What is it? What is it? Get it. Right here. Get it. Oh, good boy. You got it.
Good boy. You are just the sweetest little love bug.
And
You know
see,
that.
now his,
No, thank you for the kisses.
now his tail's wiggling.
Mm-hmm.
But other than that, I don't have your face in here.
Oh no, you're fine.
Just for my mom.
Yeah.
Just because my mom really understands this stuff. My mom has had pit bulls her whole life,
Yeah.
and all of them have health issues.
Yeah.
And this is new to me.
Mhm.
And then I was crying and panicking, and I have not heard a word y'all have said all day.
I
So
understand.
I'm just
I understand.
just rolling it on the floor.
Hi.
Oh, there's your sister and your
How are
brother.
you?
There's Sissy and brother.
Oh my goodness. I love it. It's a family of long babies. That makes me happy. Yes.
And see get out my coffee. And another thing that's worrisome is these two.
Mm-hmm.
They all hate each other, but they all love each other.
Mm-hmm.
And these two right here, he's a boy, she's a girl.
Mm-hmm.
They've been sleeping with him.
Okay. And that's abnormal?
Very. I mean,
Yeah.
when I tell you very, I don't think I could bribe them with a you know what.
Yeah.
I don't think I could pay them. I don't think there's anything I could do to get these dogs to snuggle
Yeah.
with him. And they've been laying on top of him.
Oh,
So one is
Yeah.
laying on his back while the other one is laying on the side with the mass.
yeah.
And then they've been sticking their noses in his ear, in his
Mhm.
mouth, in his butt.
Mm-hmm.
They don't usually do that.
Yeah. They're definitely, these
They-
guys definitely have like a sixth sense where they can tell if something's going wrong, be it with another animal in the house, with us. Like, shoot, I had a really rough night at work last night. My male cat came running right on up to me. He never does that when I get home. So these guys definitely have a sixth sense. They can probably tell if he's not feeling well. They're worried about him and all that stuff. So, yeah, I would definitely get him in for a consult for both the dental and the mass removal. And I have done procedures like that in the past. And it's definitely a good idea to just get it done all at once if you're able to do it. That way they're only under anesthesia the one time versus, going under for the mass removal and then going back under 6 months later, because it's just going to be a whole lot more anesthesia.
He didn't go under to get his teeth done because I was scared.
Yeah.
To put him under because of his age.
Yeah.
But everyone kept telling me
Yeah.
his age has nothing to do with it and that he's fine.
Mhm.
I've seen so many dogs.
Yeah. Yeah.
And I don't want to finish that sentence.
I understand. I completely understand. I would say if we're really concerned about the anesthesia and you have to pick one over the other, the mass taken care of first.
Mm-hmm.
All right. And then there are things that you can do at home to help keep their teeth clean. There are like the dental treats, the greenies. Hills makes a prescription diet called TD that I've had a lot of clients use as treats. They're larger. They're maybe like yay big. They just chew on them for a little bit longer. That helps get some of the plaque and tartar off their teeth. So those are some things that you can do at home to kind of help with that. But yeah, if you're worried about the anesthesia, I mean, it's very, very safe. It's a very safe anesthetic. It's the same anesthetic that they use on us, that human doctors use on us. So if we are worried about the anesthesia and or the length of time that we're going to be under, I would prioritize the mass over the teeth.
Okay. So the clindamycin got his face to where it is now,
Mm-hmm.
but his teeth were so bad
Yeah.
that you couldn't see his eyes.
Then you're probably going to have to do them all at once because that sounds like severe.
It was severe.
Severe dental disease.
Yeah, we took him to an emergency vet
Yeah.
where what did they say? They needed to be pulled that day.
Mm-hmm.
They said that they needed to be pulled that day.
Yeah.
But it was $7,000.
Do you have a primary veterinarian? Where do you guys normally take him?
Acredale,
Acredale?
but they've been going to Churchland Animal Clinic. But
Okay.
when we got who's crying?
Ale?
So we got Big Boy right here,
Mhm.
little man. Little man is only 5 months, and when we got him, he had all of his shots, came with all of his paperwork. The only thing he needed was the very last thing that, I don't know what it is, the very last shot that you get before he can be released out into the world to play with other dogs.
Yeah.
We took all the paperwork there. They opened everything up. They said, wow, perfect. You know, he got everything. All he needs is just one shot. He's good to go. So then we get the bill and we're looking at it. They gave him the first shots again. They basically, he got doubled on every single shot, first and second, and then he never got his second shots. So then we transferred over to Acredale and found out all 3 of them have worms, and they've had worms for a while.
Oh, wow.
And we were getting charged for fecal tests, but they weren't really running the fecal tests.
Gotcha. Yeah,
So we transferred.
I gotcha. Yeah, just I would definitely try to get him in with your primary sometime this week, ideally. You know, discuss, and we'll get records sent over as well. We always send records to the primary. So we'll send over records from today, just kind of discuss, you know, this is the situation with the mess. This is, you know, you guys have their records. If for some reason they don't get sent over, call us and we will send them immediately.
Okay.
It's very rare that happens, but on the off chance that it does, let us know and we'll get them over same day. But, you know, let them know what's going on with Mass. I'm sure they're already aware about the teeth. I'm sure they've gotten that,
Yes,
that other
they got
emergency
the-
report. And just definitely, I would ask the surgeon's opinion, whoever's going to be doing the surgery, what their opinion is. See what they recommend and follow their directions. Especially since they're your primary vet, they're going to know your animal a whole lot better than us here at Emergency. They know his history a lot better. They have more thorough records on him. So definitely get your primary's opinion about how they would like to proceed surgically. Okay, but I definitely think if we're able to do it all in one go for it.
Okay.
But yeah, his chemistry was perfect today after we reran everything. So
Oh, and by the way, she came in, as soon as she opened the door, she said, good news. Good
yeah,
news.
so what had happened was we had overfilled the tube that we put into the machine, and sometimes it just won't spin down correctly in the machine, and that skews all the values. So we reran the full chemistry, and it looked great.
Okay.
So, and Doc's just finishing getting discharges typed up. We're gonna come in, go over medications. Y'all get a paper discharge sheet with everything written down for you. And if y'all have any questions after you get home, we are here. We have someone here all night. I will be here until midnight. But we do have a doctor on overnight as well. So if you have any questions, call us, let us know. We're here to help you guys, okay?
Did anybody recheck? They said they were going to recheck his temperature.
I
Because he
don't know
came
that
in.
we have. Let me double check for you.
He came in
If
with
we've not, are you guys okay with us doing that in here?
Yeah.
Okay, if we not, I'll come in and take care of that. I'll
Okay.
get that done and we'll make sure everything's looking good.
Because
Okay?
I actually don't know how to take his temperature. I would like to learn.
Yeah, absolutely. It's super simple. It's just you want to get
Yeah,
a rectal thermometer, a little bit of lube, and then just
Yes.
up the booty.
Does it have to be a
So-
dog thermostat? No?
No, you can get and actually it's cheaper for us too. Most offices that I've worked at actually ordered human rectal thermometers. So you can just go on Amazon, search a rectal
Human
thermometer.
rectal thermometer.
You don't even have to specify human, just rectal thermometer and
And then
Yeah.
what else? What other vitals do you take? Do you take his blood pressure? Do you check? Do you check his heart rate?
yeah
How can I check his blood pressure? Same thing.
So blood pressure, we have a special, we use the cuffs like they do on us. You know how they hook us up to a machine at the doctor and then it blows up? Same thing. So you can order.
I have a
Cuffers?
pediatric cuff because I'm so tiny.
Yeah.
And I got a lot of medical issues. So my pediatric
Do you know what
cuff.
size it is?
Well, it goes right here.
On your wrist?
Yep.
You see, can I see your little leggy?
I'm gonna keep your face.
You're very
Keep
cute.
your face out of there.
Can I see your leggy? Hi.
Hey, come here, baby.
I would maybe go one size down if you're able to get a smaller cuff.
So it actually adjusts, and it will go all the way to this big, all the way
then
to.
you could definitely try that on him. Do you have a machine?
It's the machine.
That reads
It's
it?
all in one.
Okay. I'm not familiar with using the machine on these guys.
I can take manual.
Yeah, you can definitely take a manual one.
Okay.
So it's just like it would be for us. So
Where would I put it?
so for him here, I'll show you on this guy because
Yeah,
we're sitting here.
he's
Hi.
easier.
So it'll just go right here.
The cuff is gonna go right here.
Right here. and then your
Here.
stethoscope will go here.
So okay, so
that's
I can,
where their pulse is. And
I'm gonna listen for the ticks here, and then I'm gonna get them here. Is it the same thing? I'm not gonna go over 200.
Yeah.
Okay. So same thing as a
Easy
human.
peasy.
Don't go over 200. Cuff is gonna go here.
Heart rate, respiratory rate, the same.
Heart rate.
You know how to check their gum color.
So yes and no.
So you want
This one bites actually.
it's okay. Nice and pink like that, and then you want to press in. That's how you're gonna get your CRT.
Capillary test.
That's how you're gonna get your CRT right there. So,
Can you pick him up?
and you want them to be nice and moist. If they're tacky, then
What is
maybe a little bit
tacky?
dehydrated.
Oh, okay, okay. So
And then I know, oh, little friend.
say I have
So
that
right here?
CFS
And then you press, and you watch it go from white
to
and
right back.
and just count the number of seconds.
Yeah, and
So-
sometimes it's instant. If it's instant, it's good. And then what is it? 10 seconds is no.
Yeah, anything above 4 seconds is concerning.
Anything above 4 seconds is concerning.
Alrighty, let me go check on y'all's paperwork and your medications, and we'll be right back in, and I'll double check on his temperature to make sure we reach it back there, okay?
And then I'm so sorry to throw you up the questions,
you're
but
fine.
what do I do if his fever won't go away? Because I'm very concerned about the fever. His belly is on fire.
Yeah, let me recheck his temperature. If his temperature is abnormal, I want to touch base with Doc
Okay.
and see what she says.
Okay. Because when we came in, it was high.
Yeah, let me go see what it's at. Hi! You're very cute. Give me 1 second.
Thank you.
Yeah, absolutely.
All right, I'm gonna end this one, and then we'll have part 4.